Good morning, I'm Dave Duncan, and welcome to another Central Alabama Business Break. Joining us this morning is Dr. John Touliatos and William Mahaffey, and we're here today to talk a little bit about GERD. So, Dr. Touliatos, we'll talk to you first. What is GERD?
GERD is an acronym we use in medicine that stands for gastroesophageal reflux disease, more commonly referred to as heartburn or indigestion.
Okay, so what are some of the causes of GERD?
Most people with GERD have a hiatal hernia, but basically it's a defective valve, the lower esophageal sphincter, which allows acid to get from the stomach up into the esophagus.
Okay, so what are some of the risks or complications of GERD?
GERD is thought mostly by most patients is just a benign disorder, something they have to suffer through, but it can actually have some serious side effects. It can cause scarring and difficulty swallowing and can even lead to some cancers.
Okay, so what are some of the alternatives to chronic medication?
Well, there's two surgeries that we do now laparoscopically. One is the Nissen fundoplication, which is a traditional approach where we wrap the stomach around the esophagus to create a new valve. But a newer approach is called the LINX. It's a magnetic sphincter which has a lower side effect profile and excellent longevity.
Okay, and of course, Mr. Mahaffey, why did you choose to undergo the surgery for specifically LINX, and have you been pleased with the results?
First of all, the main reason was it seems to be a much more sensible approach to solving the problem. And that's the reason I chose it, and I've been very pleased with the results.
Okay, so what does a patient watching need to do if they're suffering from GERD?
Well, if they already have a diagnosis of GERD, they can call our office and we can evaluate them to see if they may be a candidate for surgery. If they don't know for sure, then I would just talk with your primary care physician first, and they can evaluate you as well.
Okay, very good. Well, thank you for coming up today, and thank you for the good information. And join us next time for another Central Alabama Business Break.
This has been a Central Alabama Business Break. Good Day Alabama continues after these messages.